Hello, friends. Again, here it's Dr. Amit Karkare. I'm a homeopathic doctor and a bachelor practitioner and practicing homeopathy and bachelor therapy for last more than 20 years now in Pune. So we were discussing about certain remedies, but in between we always take certain practical questions or the practical topics which also come to our mind whenever we are thinking about either prescribing or taking flower remedies for ourselves or for our near and dear ones. So this is a typical question that arises in anybody's mind, that should I need to take these remedies lifelong? If I'm taking these remedies for my fear or for my anxious behavior or for my anger, for the anxiety, whenever when the exam appears, should I be taking these remedies for lifelong? Now the question is simple. These are all natural remedies. They follow natural laws. So whatever happens in nature, everything happens in the same manner in bachelor remedies. Whenever you are thirsty, you drink water. Whenever you are hungry, you eat the food. Whenever there is a rainy weather, you obviously carry your umbrella and you wear a raincoat so that to protect yourself from the rains. You don't wear raincoat in summer. You don't use sweaters in summer, while as you don't put an AC in a harsh winter. It's the same manner. Whenever something is needed, you use a particular thing till the time there is a need of that particular thing to be used. Same thing applies in bachelor remedies, especially in acute cases. Like for example, I have an interview or a US visa appointment for me, and then I'm feeling very anxious. I'm feeling very restless from within. I possibly will need rescue remedy for that particular thing. Now, once the interview or the exam or if I'm giving some presentation on stage, at the moment that that event passes, it passes successfully, or the moment the event is over, my anxiety obviously is gone. Like because the anxiety was specifically related with the event. So once the event is gone, the anxiety is also gone. In that case, there is no need to continue with rescue remedy or this thing, because it won't be needed basically, because there is no anxiety left now. In the same manner, if I lose my some close and near and dear one, if I'm in grief, if I'm feeling shocked, if I'm feeling terrible, and if I take some flower remedy combination, the moment I'm out of that particular phase, I can stop my those remedies. Maybe I can continue it for another 1 week, just as for the maintenance. But otherwise, I can stop that remedy whenever the need goes off. This happens with the acute or the mental state situations, where you know that the situation was particularly because of some event, and that was a transient or that was a temporary event. But whenever we take remedies as type remedies, I don't know whether we had discussed type remedies and the state remedies, but type remedies are those, or type remedies are for those conditions where we are taking those remedies for our own temperament. I'm an irritable person, or I'm an anxious person by nature, by temperament. So whenever I go into any situation, I usually, uh, predictably, I show a typical irritable or an anxious or a depressive kind of behavior. So that's my pattern. We all are known for our nature, and there are always some negativities or some negative qualities in our nature for which we can take flower remedies. Like for example, I will talk about myself. I had asked you this question in my earlier videos. There were lot many that there was a lot of gap in between my earlier videos, and I had asked you that which remedy I might have taken, and most of you had in the comment section, you had guessed it right. I had taken hornbeam. So I have a temperament of hornbeam, where I always feel that making these videos, answering those is a huge task, and because of my practice and because of my other commitments, I won't be able to do that. But now you might have seen that this is my fifth video now in last 3 4 days. So I can actually make 5 videos in 3 days, but I still feel that I won't be able to do it, because I feel that task is a humongous task, and whenever I start doing it, I just do it very fluently and very easily. That's hornbeam state. We have discussed hornbeam. If you have not seen that video, please go and watch that video. So that's the hornbeam stage. I'm by temperament, I'm a hornbeam person, where I take some time to start with a task, but whenever I start it, I just finish it very effectively and very easily, basically, and much before the expected time period. So this is typical hornbeam. Now, should I be taking hornbeam every day? Yes, I should be taking hornbeam every day if I want to get over this pattern of mine. But then, will I need it for lifetime? Because that's my basic nature. I think whenever I feel, again, whenever I'm thirsty, I should drink water. So whenever I feel that hornbeam tendencies are coming up, because those are my basic genetic tendencies, whenever they will come up, I should take hornbeam. Whenever I feel no, no, now I've come out of those tendencies, and I no longer feel I feel the need to procrastinate, or I know no longer procrastination. I no longer go into procrastination, then I should stop taking hornbeam in that particular situation. So though I'm taking any remedy for my own nature to take care of the negative qualities of my nature, I think if that quality has gone down substantially, like we discussed earlier, if it is not hampering my productivity, and if I feel now I'm okay with that particular negative quality, and I've got rid of that quality for time being, I can stop that remedy. Whenever I again go into that, we can again start with those remedy. So there is no need to take any remedy for lifetime. These remedies, as Dr. Batch says, are to make us a better person. And I always feel that's my sincere belief that I have, which I always share with my patients, that we all have negative qualities. Uh, I like, for example, I discussed about my procrastination, which is usually my procrastination is taken care by hornbeam. Now, whenever I take hornbeam and I get rid of that procrastination habit, now that's a positive cycle or a positive state in which I go. Now that positive cycle and the positive phase where I'm doing my tasks efficiently, I'm doing that task immediately, I'm not procrastinating, that itself gives a lot of positive boost. It gives me a lot of motivation and inspiration, and that creates a positive cycle. That's the way we have negative vicious cycles. There is also positive input or positive feedback cycle in nature. So whenever I'm doing something good, that obviously creates a lot of good self what I would say, a good feeling about myself, and that obviously gives me a positive feedback or positive boost, and I there is a more likely possibility that I will remain in that positive cycle for a much longer time. It's easier for any human being to remain in a positive cycle than remaining in a negative cycle, because you always suffer in negative cycle, whereas you always enjoy a positive cycle. So enjoyment is something you always feel comfortable in positive cycle. So whenever we talk about breaking out of our comfort levels and going out, even the positive cycles or the positive state also is quite comfortable, and it's better to be in that comfortable state of positivity. And that's natural, that happens with everybody. So whenever you get rid of your negativities through bachelor remedies and go into a positive state, which you were trying to achieve throughout your life, it helps you to sustain in that, or to remain, or to be in that state for a longer time, and then you won't need any remedies henceforth. So all the best. Do use these remedies to take care of your temperamental issues, as well as some transient temporary issues that come on the emotional level. I hope that you all will achieve a complete, what I would say, complete relief from all the negativities, and become a complete and a better and a healthy, completely healthy human being. That's what Dr. Batch wanted us to become through these remedies. Thank you again for watching these videos. Please do subscribe to this channel. Please do share this video. And as I said last time, please do write down your comments. But if you have any questions, instead of writing them in the comment section, please send me an email. The email ID has been given in the description box. The reason is I don't have any team to manage my YouTube channel or my YouTube videos. I do it all myself. We can discuss about what remedy should be taken for such people who do not possibly believe in the team, but they do it on their own. You can write down that remedy in the comment section maybe. But I do it myself. So because of my clinical practice, because of the other commitments, I usually don't get time to check the comment sections every day. So there might be delay in replying to you, and there has been a few months delay in replying few people. I'm very sorry for that. So I would definitely be very regular in replying to your comments. But if you have any query or if you have any urgent question for me, do drop an email. I'm sure you will get some answer in 24 hours. So again, thank you for watching this video. Please subscribe to our channel for regular videos on health, homeopathy, and bachelor remedies. Thanks a lot.